Hi, my name is Dr. Robin Abramczyk, and I'm a general dentist in Heath, Texas. The name of my practice is Smile Ranch Dentistry, and I actually practice holistic and biological dentistry. Another big important part of my practice that we love passionately is performing infant frenectomies. And I am here with one of our very good friends in IBCLCs, who is a preferred IBCLC that we send our patients to regularly. This is Mellanie Sheppard. And can you tell us a little bit about yourself and the name of your business, where you're located?
Okay, my practice is called For Baby's Sake. I practice with two other lactation consultants in the Mid-Cities, Arlington area. And our primary focus is babies that are having beyond the usual breastfeeding issues. We see a lot of babies with tongue tie. We see a lot of babies that have what we generally would call structural issues.
Yes.
They've got some torticollis or tightness in their body. We work with a lot of moms with low milk supply and gut health issues.
That's wonderful. Well, I know we send a lot of our babies to you, and we appreciate that so much. One of the biggest concerns that I struggle with in trying to get the point across to moms is that they're really not aware of, who do I go to? Well, I saw a lactation consultant in the hospital and they didn't identify lip tie, or this person has worked with some babies but maybe they haven't had the progression or improvement that we would like to see. And that to me is very disheartening, because I try to emphasize that I need them to see someone who's very familiar with dealing with babies who have tethered oral tissues. So do you see that commonly, and do you hear about that?
We do, a lot. I would say probably at least 50% of the families we see have seen other lactation consultants or other breastfeeding helpers that just haven't quite had the tools that they needed to help them along. And so part of it is, there's a lot of, anytime there's something new in the world of medicine, there's some resistance to moving forward. And so some of it's political. Some hospitals won't allow their lactation consultants to talk about restricted oral tissues.
Exactly.
And so,
well, sometimes I'll have moms who they're insistent on seeing someone that they know or they feel comfortable with, and they really don't. The baby doesn't get improvement. And from what I've learned is that it's very important right after the release, and there's a window of time where we need to get in there and make intervention early. And if that doesn't happen, the baby can actually regress.
Right, and mom's milk supply suffers, and
exactly.
So yes, and I would absolutely say, when you're working with somebody for help with breastfeeding, if you suspect a tongue tie, you need to talk to the person that you're working with and find out how much knowledge and experience they have.
Absolutely.
And nobody should be offended by somebody
Absolutely
asking,
right.
how much experience, how much knowledge. I'm never offended. I
Never
welcome those
offended.
questions.
Absolutely.
And if you're not seeing results and improvement, don't be afraid to seek a second opinion.
Absolutely.
And
always go with your instinct.
Exactly.
I always tell my moms that.
Exactly.
Now, you're an IBCLC.
Yes.
What is that?
So IBCLC is International Board Certified Lactation Consultant.
Okay.
And it can be confusing for parents because they hear the term lactation consultant, and that could be a certified lactation educator or a lactation counselor, but IBCLC, we have the most education and training.
A lot of education. A lot.
It takes, generally for most people, 3 to 4 years to get through all of the training
So thousands
and
of hours
instruction.
of observation.
Yes, it's not a 1-week course. It's not a weekend course. It's, when I certified, I had to have 4,000 hours.
That's so powerful.
Hands-on, hands-on working with moms under the supervision of another lactation consultant.
Okay,
so
yeah,
it's a lot of time and a lot of effort.
The knowledge base is so much more rich.
Yes.
Absolutely.
So we're not just learning how to position babies. We're learning
Absolutely.
about all of the issues that can affect breastfeeding.
So one thing that I highly recommend to every mom who comes here is that they're evaluated by a knowledgeable IBCLC prior to the release. Why is that important?
It's so important for several reasons. We're not just looking to see, is there a tongue tie, is there not a tongue tie? We're looking to see, how does baby function? How does baby look at the breast? Are they struggling to get enough milk? Are they, gulping and choking on the milk? Is there a milk supply issue? Is mom dealing with mastitis and plugged milk ducts? Does she have severe nipple wounds that we need to talk about how to heal them and how to protect the milk supply? And then on top of that, we work very closely with the preferred provider, so we know who to refer moms to if there needs to be a tongue tie or a lip tie release, or if there are structural issues, who to refer to for that. Very, very rarely do we see a baby that tongue tie is the only issue. And so if people just go straight to have tongue tie released and their issues are not immediately fixed, they get frustrated.
Absolutely.
And they really need somebody to kind of guide the process.
Exactly. And so fast forward to, you've identified these compensations and these issues that are specific for each mom and baby nursing dyad. It's different for everyone. Fast forward to post-frenectomy. How can that information that you gathered from your initial evaluation assessment help them after the release?
It's so helpful to see what baby was doing before and to see what they're doing after, but also to talk moms through the whole process. We're working with them, I've had several this week, and it just, sometimes you just need somebody to talk you through, baby's sore afterwards and you may not want to nurse really well, so this is what we're going to do to make sure baby gets fed.
Scary for mom.
Yes, it's terrifying.
Terrifying. So, I've had some of my babies who maybe not have gotten the appropriate information from someone who is dealing with breastfeeding, and then I send them to someone like you who's very knowledgeable, and there is tremendous improvement. So that is so important. I wanted our viewers to get that, to emphasize that point.
Yes.
So how can our parents get a hold of you if they're interested in talking to you?
We have a website, forbabysake.com.
Okay.
We are also on, I know a lot of parents are on Facebook, and so we, try to stay active on the Texas Tongue Tie Baby Support Group, so that we can, answer some questions there.
Okay.
We have a Facebook page that's For Baby's Sake.
For Baby's Sake.
Yes.
Okay, and then do they come to you, or do you go to their homes? How does that work?
We do a little of both.
Okay.
We do home visits within about 30 miles of our area.
Sure.
And then I have an office in Hearst that I get moms come from all over. I've got a mom coming from China next week. So seriously, all over.
Yeah, that's wonderful.
And then my partner Deirdre has an office in Arlington.
Yeah.
And so we try to make it so that we can get
absolutely accommodate so many.
Yes, absolutely.
Wonderful. Well, I thank you so much for sharing this wonderful information. It's helping a lot of moms and babies, I know.
We
All right.
love what we do.
And we love working with you. Thank you.
Thank you.
And thank you for joining us today.